Hello and welcome to Afis Concept TV, where we give you the latest news, gist and gossips. To all our listeners and subscribers, we say thank you for always tuning in to listen to us. And if you are just joining us, we say welcome to Afis Concept TV. Kindly click on the subscribe button to subscribe to our YouTube channel. And do not forget to turn on your notification post to be the first person to get notification when we upload them. And now to the news of today. The headline: Beware, run away from eating onions if you are suffering from any of these diseases. Number 3 is very important. And now to the main news. Onions are a common ingredient in many cuisines, but they can exacerbate certain health conditions. Here are 4 sets of disease victims who should avoid eating onions regularly. Diabetes patients. Diabetes patients should limit onion consumption as they contain a high amount of sugar and can raise blood sugar level. Onions also have a high glycemic index, which can cause insulin resistance and worsen diabetes symptoms. Additionally, onions can interact with diabetes medications and reduce their effectiveness. Consuming large amounts of onions can lead to complications such as nerve damage, kidney damage, and vision problem. Also, gastroesophageal reflux disease. GERD patients should avoid eating onions regularly as they can relax the lower esophageal sphincter, allowing stomach acid to flow back into the esophagus and worsen symptoms. Onions can also irritate the esophageal lining, leading to heartburn, chest pain, and difficulty swallowing. Consuming onions can trigger GERD symptoms, making it difficult to manage the condition. Number 3. Irritable bowel syndrome, IBS patients. IBS patients should limit onion consumption as they can irritate the digestive system and worsen symptoms. Onions are high in fructose, which can be difficult for some people to digest, leading to bloating, gas, abdominal pain, and changes in bowel movements. Consuming onions can trigger IBS symptoms, making it challenging to manage the condition. 4. Bleeding disorder patients. Patients with bleeding disorders such as hemophilia should avoid eating onions regularly as they can increase the risk of bleeding. Onions contain a compound called quercetin, which can thin the blood and reduce platelet count, making it easier to bleed. Additionally, onions can interact with blood thinning medications and increase the risk of bleeding. Consuming onions can lead to bleeding complications, making it essential to avoid them. In addition to these conditions, individuals with other health issues such as stomach ulcer, acid reflux, and digestive problems should also limit onion consumption. Onions can irritate the digestive system and worsen symptoms, making it challenging to manage these conditions. In conclusion, while onions are a healthy ingredient for most people, certain disease victims should limit or avoid onion consumption to prevent worsening symptoms, interactions with medications, and increased risk of complications. Diabetes patients, GERD patients, IBS patients, and bleeding disorder patients should consult with their healthcare providers or registered dietitian for personalized advice on onion consumption. By being mindful of onion consumption, individuals can manage their health conditions effectively and reduce the risk of complications. Well, that is, if onions are a good source of health this thing, but for those that have GERD condition, for those that have IBS, for those that have issues with stomach ulcers and all those stuff, they are telling us that we should reduce our intake of onion. And even if you want to take it, you should meet your dietitian or you meet your doctor so that they can explain to you on how to limit your intake. Onions have a lot of health benefits. but it should not be taken by those that have this medical condition. If you are diabetic, if you have GERD, you should limit your intake of onions or probably erase it from your diet totally, just to be on a safer side. My listeners, kindly leave your thoughts in the comment section. Do not forget to like, to share, and to subscribe to our YouTube channel. Thank you for listening. See you some other time. Bye.